Now, a deadly infection. It is spreading across the United States, and health experts here in Atlanta, they're leading the charge to stop it. Their biggest concern tonight is that the superbug is drug resistant. Very scary. CBS 46 reporter Brittany Miller is live outside the CDC. And Brittany, hundreds of cases have already been reported across the country.
That's right. Tonight, the CDC is calling this an urgent threat. I just checked the numbers, and as of late February, there have been more than 600 people infected in 12 states. Georgia has already seen several suspected cases. Behind these doors, epidemiologists are aggressively trying to control a deadly infection called Candida auris.
People may be familiar with yeast infections, and that's in the context in which most people know about Candida infections, but they actually can cause serious infections that result in death.
Epidemiologist Signa Valsbanani explains the Centers for Disease Control and Prevention's concern.
It is highly drug resistant, and that's something we haven't seen before.
She says it infects the bloodstream, killing 40% of those who get it. However, at this point, the disease is only impacting certain patients in hospitals and nursing homes.
Someone who's been in the hospital a long time in intensive care.
She says it's likely the average person won't get it, but
it's possible that it could affect a bigger number of people, and so we want to do everything we can to prevent the spread.
The expert says you can stop the spreading with really good hand washing, environmental cleanings of hospitals and equipment, also using gloves and gowns. The good news?
We do have one antifungal medication that can treat most of the strains of Candida auris that are in the U.S.
But it's the only drug left. Disease detectives are worried the superbug will become untreatable as it becomes more resistant.
What we need to be doing is be ready to detect it when it does get here.
And I checked with the Georgia Department of Health tonight. They say that the Candida auris has not been identified in the state. However, last year, 10 suspected cases were sent to a lab. All of them came back negative, Sharon.
Brittany, what are the risk factors here?
So any patients that are in the hospital who are very sick, again, are most at risk. Think about anyone that has a lot of medical equipment, feeding tubes, ventilators. Those are the people you want to keep an eye on.
All right, as we said, very scary stuff. The CDC, they're watching over this, so that is at least comforting. But again, boy, be on the lookout for this one.